Left Wing Kingz. Listen, think, act, repeat.
Mental health is a complex and challenging condition that affects millions of people worldwide. However, the Black community faces unique challenges when it comes to mental health. So today we're going to go ahead and explore the 5 key concerns of mental health with a focus on dementia. Now, I was about to say, Claude, I know you have an experience with this, so we're going to jump right into concern number 1, which is the diagnosis delays. So early diagnosis of dementia is essential for effective management and care. Unfortunately, Black individuals often experience significant delays in receiving a dementia diagnosis. Claude, how did your diagnosis come about, and what challenges does dementia cause in your life?
Sure. Thank you. So in November of 2022, I was diagnosed with early onset dementia. I had COVID in 2020 of July. And as you know, during that time frame, we did not have any significant testing centers for individuals to go to, especially in the Black neighborhoods. So I waited like 3 weeks before I even got a chance to see doctors. So one of the things that I accomplished was, with working for the Department of Defense and working in the healthcare environment, I had direct access to nurses and nurse practitioners and PAs. So I survived basically working on the household remedies without going to the emergency room, without going to see a physician. And I would say about maybe 10 months, should I say, after that, I started having memory fault issues. I started having issues where I would forget my keys. Started having issues where I went to the mailbox and ended up at HEB, not knowing why I was at HEB.
Wow.
So I went through a lot of psychological testing, a lot of mental health testing to solidify a diagnosis. At that time as well, I started experiencing some damaging hearing loss. And so right now I have a 60 to probably 65, 70% hearing loss in both ears. I wear hearing aids. That has been a success factor for me. Although in our Black communities, you have individuals that are still experiencing the difficulties of getting hearing aids. For example, my hearing aids are $5,200.
Man.
Thank God I had federal government benefits.
That's a damn used car right there.
That's right. That's right. That's right.
I think I just ain't gonna hear nothing. You know what I'm saying?
That's right. That's right. Absolutely. So
call Helen Keller because I'm just
yeah, exactly. So then after going through all of the testing and experiencing the anxiety factors, I was sick at home, and I just had to come to grips to go to the psychologist, go to the neurologist, go to the speech person, and hey, let me do these tests. And it came back saying that I had frontal and temporal lobe shrinkage, which impacts the emotional and behavior side, and also my cognitive side. So I have a cognitive impairment to include behavior and emotional issues, which stems from that onset dementia. I think it's very, very important for us to get treatment. I still hear today from Black Americans that say that they have memory fault issues. My advice would be go through your primary care physician to seek testing and seek treatment to identify what that treatment should be.
Yeah.
Hey, Claude, real quick, let me jump in real quick.
Yes, sir.
What would you recommend the age be to start looking for signs for that?
Well, the onset dementia criteria could possibly start at the age of 50 through 65.
Okay.
they did mention that I would have probably had dementia at the age of 75 to 80, but COVID triggered those actual symptoms
Wow.
and the actual diagnosis.
Wow.
So,
Oh wow, that's yeah, and we were talking about the delays in diagnosis and listening to your struggles. You're in the medical field, so a lot of things you were able to do was because of your connections. Imagine if you didn't have those connections.
oh yeah, absolutely.
Yeah. So
I totally agree, and I think not just having the connection and the resources, but within Black America, the education plays a major role in this.
Sure does.
If you are a high school graduate and you don't have the resources, the educational and the financial resources to get checked, then you fall amongst the wayside, because I can guarantee you, if you are dependent on the government and these subsidy programs to get you in, you're dead.
yeah.
Well, I think that this is a great tie-in to concern number 2.
Yes,
And
sir.
concern number 2 is healthcare inequities. So healthcare inequities play a significant role in the challenges faced by Black Americans with dementia. This disparity is often due to, like you said, systemic racism, socioeconomic barriers that exist, and a lack of culturally competent healthcare providers. So, Claude, what are some of the healthcare challenges that we might experience as Black Americans, and maybe even tie in some of those things that you've experienced?
Yeah. And so I know from my focus and my lens, as I look back on this and some of the things that I have done, and talking to family members and also friends and coworkers, COVID-19 had a very much so impact to the world.
Yes.
And from a government perspective, we talk about the continuity of care, the access to care, and some of the things that we need as human beings. And I can tell you that there is a health disparity amongst Black Americans. There is a mental health impact amongst Black Americans. I can tell you that the economic strain is tremendous within the Black community prior to COVID and post-COVID. Prior to anyone having memory loss or memory fog. And also, there is a concept that's out there that is real. It's called educational disruption. And educational disruption is the ability to have access to the resources so that we can remotely understand and make a determination what needs to be done, just from a humane perspective.
Right.
So those are the 4 things that I've seen that play a major role. Now, also, let's be real, okay? Project 2025 also has an impact to all of these situations. Black patients having the ability to have continuity of care, access to care, mental health communities for the color. Okay, I have great insurance, so I have 2 neurologists, I have a psychiatrist, I have a psychologist, I have an endocrinologist, I have every special care provider and every primary care provider within my treatment plan that supports the possible disparities that I would embrace as a Black man.
Yeah.
So I say blessings to me, but I fight for my Black Americans as well.
Yeah.
So when we're talking about Project 2025, guys, don't let the Trump administration fool you.
Yeah. So
that's real. And dig a little bit more into 2025. We talk about it a lot here on the show. But what are some of the effects 2025 are going to have on, getting mental health care and stuff like that? I mean,
For the elderly, and this is what our focus is. It is my understanding by just glancing through the Project 2025 document that Medicare Part D enrollees nationwide are going to be impacted. And it doesn't matter who you are.
Yeah.
If you see that there is a reason for the Trump administration to be voted in, then guess what? Wake up.
Yeah.
Because there are a lot of targeted and proposal stipulations that are in there that are dismissed. And so if you're not aware of it, do some research.
Yeah, they're fighting for deregulation, and that's going to affect a lot of the organizations that you're talking about, medical organizations, but also they're rooting for big pharma. You know what I'm saying? So they're gonna raise medication, and this is something they got written in that $900 page document.
Yes.
You know what I'm saying? So
Yes.
yeah, you got to be aware of that.
Yeah. So I would say to the audience and the community, educate yourself. That document is out there. Even if you have AI experience, which is artificial intelligence experience, go out there and do the resources. Get the snapshots of what you want to see as an American citizen prior to going voting.
Yeah.
Well, I'll tell you what I want to see. Somebody hitting that like button.
He said,
so,
Claude.
if you like this content and you feel that you want everybody else in the world to watch it, and let your black brothers and sisters know about Project 2025, damn it, hit the like button. All right?
Absolutely.
And make
Does it
sure
to
that
me
you
every week.
subscribe to this channel and share this content on all of your social media platforms out there. Now, with that being said, we talked a little bit about 2025 last week, and one of the things we talked about was the fact that Medicare, like you said, Affordable Care Act, they're looking to roll back a lot of the money that they're giving to people who depend on that. And unfortunately, people in our community are highly dependent upon those resources for their health care. And so that brings us to concern number 3, which is a lack of resources. So black patients are less likely to have access to quality support services and resources. Providing quality support and resources is vital to ensure that any individual receives the care that they need. If they don't have the access, they can't get the care. So Claude, what resources are lacking, and which resources do our viewers dealing with dementia need to be aware of?
So again, there's always been a disparity within healthcare, and we title that structural racism. What does that mean? So when we look at structural racism, we're absolutely talking about the discriminatory effects in healthcare. What do you experience when you go to a healthcare facility on the south side versus the north side?
Yeah.
What do you experience when you're in an elderly retirement community, 55 and above, and you got all the healthcare individuals at the community center, and the average income in that community is $77,000 to $125,000. Imagine what that does to someone that's making $25,000.
Yeah.
Okay, now you're going to talk to me about Project 2025, and we're going to talk about a $400 savings. That's crap to us.
Right. Exactly.
There is a possibility, or there is reality, should I say, that you could spend $400 on Wegovy,
Yeah.
Done.
I would say
There
that's
you
one
go.
medication.
Mounjaro,
Yeah.
Ozempic, $400. So Project 2025, guys, again, is crap. Read it, understand it, don't vote for it.
Thank you.
Yeah, that's strong words right there, definitely. And breaking it down to where people should be able to, look at this on a day-to-day basis and see how it's going to affect them. You know what I'm saying? So,
sure.
I mean, I got medications, you know what I'm saying? So they're not going to give you anything back for that, and they're going to roll a lot of stuff that you're doing right now. Don't be blind with it. I think a lot of people want to make a mistake because they're not going to vote at all.
That's
You know
right.
what I'm saying?
Yeah.
Oh, now that's definitely a mistake, and again, that goes to us not understanding, and there are things that we have to accept at a certain degree of level, but what we shouldn't accept is for us to not vote or to go and vote for Robert Kennedy.
Oh yeah, don't do that.
What a waste of voting.
Yeah, don't do that.
All right. The healthcare bias is another one. And poverty. We can talk about poverty all day. Unemployment. We can talk about what those rates are. Socio-economical factors is also a level which does not promote you getting quality healthcare support and resources.
Yeah.
Period.
Yeah.
Let me play devil's advocate here real quick, Claude. Some of our people like to say, or some people would like to say, yeah, that was back in the day. But this is 2024, man. That ain't, that stuff doesn't affect us now. It's, structural racism. What do we say to that?
Oh, it's easy.
Mm-hmm.
Back in the day, you were hung from a tree. Today, it's modernized slavery. And Project 2025 is a firm example of what that is. So you could look back and say it's different, but really it isn't. Really, it isn't. And to me, this whole thing is that there's a time when pipe bombs are going to be dropped in your home. My dad used to tell us, hey, go to Woolworth and get a ribbon and let's make a bow and put it on the front door so that when the Black Panthers come through, they don't throw pipe bombs in your house. So, ignorance.
Yeah.
It's ignorance.
Yeah.
Get on board, guys.
Well, luckily, we don't got to worry about the risk of pipe bombs up in this motherfucker no more.
No,
who knows
but
what's
I
going to
mean,
happen next year?
you never
But
know.
There's still a risk that we have as Black Americans, and that's kind of like concern number 4, which is higher prevalence and risk factors that we have in the Black community for our health. So Black Americans are twice as likely to develop dementia compared to their white counterparts due to higher rates of things like hypertension, diabetes, cardiovascular disease, all of that. So Claude, can addressing these health issues help to slow down the onset of dementia and the symptoms that comes with the condition?
So, losing your memory is worse than losing your sexual appetite. Because when you lose your brain cells, when you lose your mind, there's nothing else. Eventually, everything else just goes away. When we're looking at what are some of those things that could help, regular exercising could help. I was just told this week by my doctor, he's like, hey, Claude, walk around the block 10 minutes every day. And don't target it as a scheduled walk. Just get out and do it. And before you know it, you done walk the whole entire subdivision.
Oh, wow.
And that equates to your 10 minutes. If you want to process something about Project 2025 or the election or politics or finances, get up and walk. So, there are many things that we could do, but understanding how to manage those chronic conditions. As I mentioned before, I had high cholesterol, hypertension, I was pre-diabetic, ADHD, bipolar, and every damn thing else. So I had to take charge of my weight. And just 6 months ago, a year ago, I was 270 pounds.
Wow.
Now I'm down to 230.
That's awesome, man.
All right. So let me tell you what has happened, and let me tell you what the impact is of you individually taking care of yourself. Diet, sleeping, stress management, social engagement, and home monitoring. And what I mean by home monitoring, get rid of the drama. Get rid of the kids that are causing you problems. Get rid of the things that in your life that are not a primary factor to you not losing your brain.
Yeah.
Bottom line.
Yeah, that's good advice, right?
Yeah, exactly. And
Home monitoring.
Home monitoring. So I went to my doctor and I told my doctor, I said, hey, look, man, I already got the brain thing going on. I don't need a stroke. I don't need high cholesterol. I need medication for the bipolar. I don't want to fight. The stressors, the ADHD. I want to stay focused. So I told my doctor, I said, you know what? Put me on Wegovy so I can lose the weight. I had 2 knee surgeries, back to back. Wegovy has been a tremendous success to me. 30, 40 pounds.
Yes, sir.
My A1C is now down to 5.2. I'm no longer not a pre-diabetic.
Awesome.
Cholesterol's down to 75. Weight down 30, 40 pounds. So there's a part in life where you have to take care of your health. And the last thing I want to say is that vascular health is very, very important for us.
Yes.
I have a 10% blockage in two arteries. I have a 10% blockage in 2 arteries. And every year I go and get that checked because my dad died from a major heart attack with 80% blockage. And I was 19 years old. So vascular issues goes through my family like someone swimming.
Yeah.
Yeah.
So we did hit our time, but I think we got one more thing that I want to touch on before we go on to the next topic.
Yes.
And it's vitally important because we're talking about things like we've been kind of mixing in and think about Project 2025, the impact of the Black community. And one of the things that is the final concern for our healthcare is number 5, which is cultural stigma and awareness. So cultural stigma surrounding mental health and dementia can prevent individuals from seeking help and support. In many Black communities, there's a lack of awareness and understanding around dementia, leading to misconceptions and fear. People are afraid to say they got this or that or whatever. They're afraid to go to the doctor, whatever. Claude, how can we increase education and awareness about dementia and our mental health to help reduce the stigma and encourage early diagnosis and treatment?
So I think one of the bad things, I'm not going to say bad things, but one of the challenging things that we have as a culture is that we don't feel that we should share our health experiences. Sharing your experiences could be the reason why someone go and get a psychological test to see why they're having memory loss. And if you don't do what I'm doing today, with sharing it with the nation, then the devil will make you think that you're the only one experiencing those things.
Yeah.
The devil comes in and say, hey, you know what? You're the only one got dementia, Claude, in the corner. You're the only one that goes to HEB. You're the only one that puts your keys in the refrigerator with your Bluebell ice cream.
Yeah.
And we sought to sabotage ourselves.
Yeah.
Shoot, when you was mentioning that, I was gonna say, shit, that's everything that I do.
Yeah, but it's funny because I was watching The Boys. I know you do all that shit. You crazy to the mom. I was watching The Boys, and there was one part where this lady says, we're all the hero in our own story. And that's what that reminds me of when you say that. Like, everybody has their own experience. When we all leave this and we by ourselves somewhere, we in the room by ourselves, we just thinking about us, and we're always the heroes of our story, and we write what we write, and we think we're the only ones out there.
Only ones out there, yeah. And so another thing is navigating the health system, okay? Make sure that you have a team of healthcare providers at one location from a healthcare system perspective so that all of your documentation is in one electronic healthcare record.
Yes.
One of the things I found out, and I was challenged with this with a very, very good friend of mine, Venezuela Body, who was an executive nurse for the military. And she said, Claude, you're running around from doctor to doctor, picking up documentation or having it scanned to your primary care doctor. Why don't you get into a healthcare system? And she also told me, nobody knows our health but an educated Black provider. Mm-hmm. There are Black cardiologists out there. There are Black psychologists, psychiatrists. Mm-hmm. So focus more on that and look at what those resources are, and have the emotional intelligence, the emotional well-being of identifying that you as a person need help. Listen to your spouse. Listen to your best friend. Listen to the people that have your support and go to the doctors.
That's awesome, man.
Yeah,
I love
that's
that.
good. That's good right there. I like that. The electronic, everything in one place. Nobody thinks like that, but you know what I'm saying. But yeah, get that to the point where when you go into all these doctors, you got all that ready for them, and it's all in one place to find.
Yeah, I have
That's
it. Like
amazing.
I think mine is under Baptist. I think medical
Okay.
system, and all of the doctors that I have, all the specialists, my primary care, they're all in there, so they can all see everything.